network and my upline for introducing elite career into my life. I'm Gladys. It's my privilege to be tonight MC. I would like to thank all of you for taking time to join us this evening. Before we begin, our AV team already mute the Zoom app to prevent any interruption to the meeting. So later on, we'll have a Q&A session. If you have any question, you can unmute to voice your question. But if you do not wish to on your mic, you may use the chat function to type in your question. There will be picture display during the presentation. If you can't see clearly, you may zoom in for a clearer view. Millions of people worldwide suffer from various types of allergies, ranging from seasonal allergies like hay fever to food allergies, an allergic reaction to the medications, or insect stings. When we have allergy, our immune system makes antibodies that identify a particular allergen as harmful, even though it isn't. When we come into contact with the allergen, our immune system's reaction can inflame our skin, sinus, airways, or digestive system. While most allergies can be cured, treatment can help to relieve your allergy symptom. Tonight, it's a privilege for us to invite a speaker to share with us tackling allergies, food, respiratory issues, and skin. Let's welcome Daniel to share with us.
So good evening, ladies and gentlemen. My name is Daniel. So first of all, I would like to thank Allergies Network and my upline for giving me this opportunity to share this preventive science that brings health and longevity to the mankind. So today's topic is tackling allergies, food, respiratory, as well as skin. So may I ask you a question? Are you worried about allergy? So one of my friends asked me, he often has rashes and his skin is prone to a redness and swelling. So is this considered as skin allergy? And some people say that they will suffer from diarrhea after eating certain foods. Does it mean that they are allergic to certain foods? And some people will have itchy, watery eyes, running nose, and never-ending nasal drip, and sinuses, stuffiness regularly. Does that mean that they are having a nasal or respiratory allergy? So allergy can be extremely annoying. Do you know why is that so? Because there's no medication to cure allergies. And allergy is very common nowadays, and more people are suffering from allergy, especially in some developed countries. So about 20% of the people suffer from allergic rhinitis, or we known as hair fever. And in Singapore, allergic rhinitis affect up to 13% of the Singapore population. And in the United States, 40% of children suffer from allergies. And 20% of the people have had atopic dermatitis, or we known as eczema. And in fact, 1 to 18% of people have asthma. Is it so common nowadays? And how can we prevent it? So according to the data I just mentioned, we know that allergies are very common. So what is allergy? So allergies are a battle without enemy. Why is that so? Why is called a battle without enemy? Because allergy occurs when the immune system launches an attack on the non-threatening harmful substances. For example, peanuts, meat, pollen, and even water or sunlight. And the body will have an allergic reaction. And according to the World Allergy Organization reported from 2011 to 2012, about 40% of people in the world suffer from at least one allergic disease. So this proves that more and more people suffer from allergy. So under normal circumstances, when the human body is infected by these bacteria or viruses, our B cell will produce this IgA, IgM, and IgG antibody to fight these germs. As for patients with allergy, his B cell will produce this IgE antibody in a short period of time when he encounters an allergen. And this could be life-threatening. For example, some people are allergic to peanuts. So when he consumes food that have peanut in it, his B cell will immediately produce this IgE within a few minutes to a few hours, which will quickly trigger the allergic reaction, such as the swollen eyes, and the allergy symptoms such as the itchy skin will appear. So what are the common allergies? So there are three main types of allergies: respiratory allergy, skin allergy, as well as food allergy. And all allergies are caused by exposure to one or more allergens. First, let's talk about respiratory allergy. So what are the symptoms? So the symptoms are sneezing all the time, running nose, especially when waking up in the morning, nasal congestion at night when sleeping, difficulty in nose breathing, and can only breathe through the mouth. And some people may even cough constantly. And eyes can easily shed tears unconsciously. And some people with a respiratory allergy will have a dark circle under the eyes, and this may be a symptom of allergy. So about 20% of the people suffer from this allergic rhinitis, or known as hair fever, and mainly because of the exposure to allergens such as the dust, pollen, dust mite, the pet dander, could be their saliva or urine, etc. So do you think all these dust, pollen are a threat to us? I'm sure no, right? But if our immune system is haywire, it will treat these harmful substances and start attacking them. And this will result in allergies. So I believe that we might know people that have asthmatic problems. So talking about asthma, there are two types of asthma. One is allergic asthma. So the other type is non-allergic asthma. So look at this, you will notice that the symptoms of both asthma are the same, such as shortness of breath, wheezing, chest tightness, and etc. But these two types of asthma are caused by different factors. So allergic asthma is caused by exposure to allergen such as the pollen, mold, cat dander, or dust mite. But non-allergic asthma is not derived from allergen. The main reason is due to excessively anxiety that causes the muscle contraction and aggravates the patient's asthma. So have you noticed it? The same phenomena occur in too intense exercise. So if you can recall, when we used to have these PE classes, the teacher would first ask any student who had asthma. So that students will not participate in some intense exercise. And some non-allergic asthma is caused by exposure to the cold air. And when the cold air is inhaled, the trachea becomes narrow, and the patients have symptoms such as shortness of breath, wheezing, and chest tightness, etc. So now, does everyone know how to distinguish it? So next, let's look at this allergy versus cold. Their symptoms are quite similar as well, but how to distinguish it? So respiratory allergies and cold can also cause running nose, nasal congestion, sneezing, wheezing, watery eye, itchy eyes. But what are the difference between these two? Let's start with their causes. So if it is an allergy, it's because of contact with the allergen, there will be no fever. And most cold are caused by the viruses. Okay. So in addition to the symptom just mentioned, there will be fever, sore throat, and body ache. Okay. So for the warning period, if an allergic person is exposed to the allergen, his symptoms will surface immediately. So what about cold? So if he was infected with a cold virus for a few days before the symptoms surface. So for the duration, if you are allergic, as long as you continue to be exposed to the allergen, the symptoms will continue to occur. But having a cold is different. The immune system will destroy the virus in a few days, and the symptom will disappear after that. So that's the main difference. So earlier I mentioned about the respiratory allergy, and next, let's look at another type of allergy, which is skin allergy. So in our daily life, skin allergy are quite common. You can see from the photo, it can affect the patient's daily lifestyle and their work, and it will become more serious if no preventive measure are taken. The most common skin allergy will cause the blister, redness, itchy skin, and it will tend to keep scratching, and dry cramps, or we call skin peeling. So what are the allergens that cause the skin allergy? So the main allergens are mostly related to drugs, cosmetic, chemicals, or metal-related substances. So some people are allergic to drugs. For example, some people are allergic towards the antibiotic. Some people are allergic towards the painkiller, allergic towards the ointment application, and once applied, it will cause an adverse reaction. And allergic symptoms included the redness, reaction, especially around the eye area, or swelling around the mouth area. So if compared with oral drug, frequent partial meal drug or drug injection will also trigger allergy easier. So followed by cosmetic. So I believe most women are careful in cosmetic selection. Some of them may be allergic towards some of the ingredients. Usually immediate apply will cause the itchiness, redness, and even the skin peeling. Our daily use supply also contain the chemical materials, for example, detergent powder, dishwashing liquid, etc. So have you ever seen people with a hand eczema? So when the hand touches some of these substances, it will trigger the allergy instantly and will even crack and bleed. And some people are allergic towards some fabric like sweaters or wool clothing once they wear it, and it will cause allergic symptoms. Followed by metal, yes. Some people can't wear the earring and necklace that contain the metal. So whenever they wear it, their skin will have a redness and itchiness. And some portion of the skin will be blackened and will cause pus if it becomes serious. Therefore, need to avoid wearing these metals. And mosquito bite, yes, also will cause allergies. So do you know what are the most common skin allergy is? So around 20% of the people have an atopic dermatitis problem, which is called eczema. And wow, this means that 1 out of every 5 person will have an eczema problem. So actually, eczema is the most common skin allergy. A lot of eczema problems are caused by food allergies. So what are the other skin allergy problems? For example, rashes, dermatitis, and boils, etc. So when it comes to food, many people think that it will only affect our digestive system. In fact, it will also affect our skin eczema and our cardiovascular system, or we call our heart system too. So in fact, food allergies are so common nowadays. And in the United States alone, about 5.9 million children and 2.3 million adults are suffering from food allergy. So common food allergy symptoms are vomiting, nausea, abdominal pain, and diarrhea. So do you have any friends that have experienced it before? So they have an allergic reaction to the food the moment they eat it. So let's look at what kind of foods are generally more likely to cause allergies. So main allergens in general are milk, eggs, fish, shellfish, nuts, especially peanuts, and other foods. So these are the foods that can be acquired easily and consumed. So have you noticed that what will happen when some people drink milk or eat food that containing the dairy products? They might end up vomiting or having a diarrhea. And some people's skin will immediately turn red when they eat seafood like shrimp, crab, shellfish, or peanuts. Sometimes it will be red, swollen, and itchiness around the mouth. So this is called a food allergy. Therefore, people who are allergic to certain food should be especially careful when choosing the food and pay attention to what food that you are allergic to. And sometimes some food containing these ingredients can also cause allergic reactions. So dairy products can easily trigger allergies. So dairy products such as the cheese, milk tea are all made from the milk. However, some people may not be allergic to the milk, but the antibiotic that found in the milk. How did this happen? We know that milk is produced by the cow, and some farmers will actually inject the penicillin, which is an antibiotic, into the cow, mainly to treat the cow for the mastitis. Then the milk produced in the next 48 hours will contain the small amounts of antibiotic. So people who are allergic to antibiotic will cause allergic symptoms if they drink milk that contaminated with an antibiotic. So milk can also stimulate the body to produce the mucus, worsening the symptoms of blocked lungs and cause wheezing. So another type is a margarine. So which is usually to spread on the bread or make the pastry. It will actually increase the risk of asthma and allergic rhinitis. So this is because margarine is rich in omega-6 fatty acid and easily to cause inflammation. And the possibility of triggering asthma also increases. So abstaining from dairy product can improve asthma and allergic rhinitis. So let's look at a study of 24 asthmatics. After they let these people suffering from an asthma experience a vegan diet for 4 months, the research reported pointed out that 71% of patients have improved. So the milk protein in milk may be likely causes of allergic asthma. And food allergy and intolerance are two different things. So when we are sensitive to a certain food, there is intolerance. It's not that you're allergic to that food, it's just that you're more sensitive to that food, especially when consuming milk, gluten, coffee, etc. There may be some symptoms and a little discomfort will cause a reaction in the digestive system, but generally it's not life-threatening. It's just intolerance, what we call sensitivity. So for example, some people are lactose intolerant. It may be missing the lactase enzyme that can digest the lactose. Or maybe there are some people, they have a skin intolerance, which means that they will have indigestion after eating foods that containing the skin's texture. This is not allergy, just an intolerance. So if it is an intolerance, our body will slowly adapt to it. For example, if you are intolerant to coffee, at the beginning when you drink a bit of coffee, then your heart will start to beat very fast. Then you drink a bit of coffee every day, okay? Then you will find that your body can adapt to it. So your heart will not beat so fast the next time you drink the coffee again. So intolerance can be adapted. But if you are allergy, that's not. So what kind of environment will increase the risk of allergy? In an excessively clean environment, so the body will not be able to be exposed to certain type of microbes. So exposing a child to the microbes from an early age can actually enable his or immune system to learn how to initiate a corresponding defense response. So it's easy to cause allergy if the immune system is not exposed to enough microbe to be trained for, especially small scale family. There's only one child in the family and less contact with animal. There are no pets in the house, less contact with a harmful bacteria. So therefore, an excessively clean environment, or such as those with obsessive compulsive disorder, always sterilized everywhere in the house, can be easily allergic. And scientists have actually found that in countries with a poor sanitation condition, their children have parasite in their body. Therefore, asthma and allergies seldom happen to them. But this is because their immune system focuses on attacking this parasite and will not pay attention to the pollen that is harmless to the body. So in short, allergy means that our immune system has no real enemy to fight with and gets bored over time. So how can we prevent allergies? So as a pregnant woman, I'm sure she wished her baby to be grow up healthy and free from allergies. So here are some tips for those pregnant women. So avoid smoking or inhaling secondhand smoke during the pregnancy. Consume right amounts of nuts if a pregnant woman are not allergic to it. If healthy and do not have any medical condition, go for natural birth because the baby born naturally will pass through the mother's birth canal, and the baby born by cesarean will actually deficient in this bacillus without passing through the birth canal. So for a newborn baby, this harmless bacillus can be used for the baby immune system to train the immune cell to train the immune system. So on the contrary, if the baby doesn't come into contact with this bacillus through the birth canal, their immune system may not have anything to train with, and this can lead to allergies. Therefore, babies born by cesarean sections are 5 times more likely to have allergy than baby born naturally. So any tips for parents? So breastfeeding as much as possible because breast milk is good for the baby's health, and breast milk is also the best source of nutrition for the babies. Help children maintain a healthy weight. This is important because overweight and obese children may increase the risk of allergy. And let babies 4 to 6 months old exposed to the food that is prone to allergy. For example, eating a small amount of nuts or egg can help to prevent the allergies. For babies who are under 2 years old, avoid taking antibiotic because antibiotic can lead to asthma. So at present, there are no medications that can completely cure allergies, but can only help to relieve the symptoms. So these are drugs that commonly used to relieve the symptom, such as steroid, antihistamine, or decongestant. So although these drugs can relieve the allergic symptoms, such as sneezing, running nose, but these drugs come with serious side effects. So for example, regular use of steroid, which will suppress our overall immune system function, can result in easier infection by the bacteria and viruses and increase the risk of cancer. So if these drugs are used for a long time, they can also affect the growth and development of the children. And some people actually turn towards the Chinese medication due to the side effects of a Western medication. However, all medication, regardless of Chinese or Western medicine, have certain level of toxicity. So once the concentration of the Chinese medicine is high, there will be side effect. So in addition, many Western medicine are extracted from Chinese medicine. For example, aspirin is a type of painkiller. The source is from this white willow bud, and overdose may cause the internal bleeding. So digoxin is another drug that used to treat irregular heartbeats, come from the source of foxglove plant, and overdose may cause a heart attack. Hence, natural doesn't mean that healthy, and both Chinese medicine and Western medicine come with side effects. So if that's the case, are there any other method we can use that don't have any side effect and can treat allergies? So we can fight against allergy with this power of nature. So the power of nature comes from the plants, including the cactus, American ginseng, cordyceps mycelium, rose, ashitaba, black goji berries, osmanthus, psyllium husk, soy. So when allergy, our body will be in the stage of inflammation, and the cactus is rich in more than 10,000 types of phytochemicals. It can exert a good anti-inflammatory function to relieve the allergic symptoms, and also the ability to accelerate tissue regeneration and wound healing. So cactus also rich in nutrient gum that can cover the stomach and the gastrointestinal tract and relieve the digestive tract problems. So most people with an allergy will be listless and tired because of allergies. So American ginseng can help to replenish the energy and relieve the fatigue. It can also quickly transport the oxygens, the nutrients, and the immune cell to the blood to the whole body. So it can also strengthen our function of the lung. And study also found that American ginseng can alleviate the cold symptoms and reduce the number of days of cold and can prevent the respiratory infections. So next, we have a cordyceps mycelium. Cordyceps mycelium is rich in a polysaccharide and can give a two-way normalizing effect on our immune system. So what is two-way normalizing effect? It helps to activate the weak immune system and at the same time to stabilize the overactive immune system. Therefore, cordyceps can help to improve our immune system disorder and diseases caused by it, including the cancer, allergy, and lupus. You also have an anti-inflammatory and anti-infective effect, so it can fight the viruses. So cactus also help to, cordyceps also help to strengthen our heart, our kidney, and our lungs. And the Beijing Medical College actually conducted a study of more than 50 asthma patients, and they found that a group of people who took cordyceps had their symptoms relieved by 81% within 5 days. So roses, okay, so roses are rich in antioxidant, and the vitamin C at the rosebud is 50 times that of lemons. So what are the effects of this super antioxidant on the people with allergy? So I believe the most troublesome things for people with skin allergy are dry skin and dandruff. And often scratches and itching will lead to the skin infection. And hence, all these are high antioxidant foods such as roses can help to promote the ability of our skin to produce collagen and help in the skin repair and wound healing. So moreover, the antioxidant or rose can help to prevent the DNA damage and strengthen our immune system and relieve the allergic symptoms. And next, we have this magical plant. We call this ashitaba. So if today I pick this leaf today, it will grow new shoots tomorrow. And this magical plant is called ashitaba. So ashitaba contains the flavonoids, which can reduce the risk of asthma, cancer, and heart disease. Ashitaba also contains this yellow angelica, which can inhibit the release of histamine, hence prevent allergic reaction. And the chlorophylls that found inside can help to promote the growth of good bacteria in our intestine. And next, we have anthocyanins from this black goji berry. So black goji berry has been reported to promote the growth of a healthy human gut microbiota and reduce the populations of bad bacteria, hence help to reduce the allergies. And next, we have osmanthus. Osmanthus are flowers that are commonly added to the tea for their natural fragrance. And research shows that osmanthus flowers effectively suppress this IgE antibody and have the potential as an anti-allergic agent. And the flavonoids that found in osmanthus strongly inhibit the histamine release, and in other words, helps to reduce the lung inflammation in the animal model. So the USDA recommended that women need about 25 grams of fibers a day, and the man needs slightly more, about 35 grams per day. So lack of fibers will lead to lack of probiotics in our intestine. And fiber can help to promote the diversity of probiotic in our intestine, which has shown to reduce the allergies. So there are two main categories of fiber. One is a soluble fiber, another type is a insoluble fiber. So soluble fiber will become gel-like in the water and is the key to help our stool move smoothly through the intestine. And insoluble fiber doesn't dissolve in water, helps to remove the toxin and keep our intestine clean, and is a key to prevent those digestive conditions such as diarrhea and constipation. Therefore, I strongly recommend to consume the psyllium husk because every 100 grams of psyllium husk contains 71 grams of soluble fibers, which is 7 times than per ox. Next, why do we need protein every day? Because the proteins we know is a building blocks for tissue, also for our skin, our hair, our nails, and our bones. So as I mentioned earlier, all kinds of animal food such as egg, seafood, and dairy products can actually cause many types of allergy. Not to mention animal foods that contain all these high cholesterol, high calorie, and can cause overnight and obesity in children, which may increase the risk of allergy as well. So removing dairy products will help asthma and allergic rhinitis. So how do we choose a source of protein? Soy is one of the best source of protein because soybean contain 36 to 56% of protein, which is 2 times that of milk, 3 times than the egg, 12 times that of the milk protein. And soy protein can increase the proportions of muscle, burn fat, burn calorie, and prevent the obesity and reduce the allergy. And soybean, one thing good, it doesn't contain cholesterol and low in calorie and fat. It's also rich in all these essential amino acid, vitamins, and fibers. And study shows that after 4 months of vegan diet for 24 asthmatic, 71% have improved their allergic condition. And next, there's currently no cure for allergies. So only certain medication they may help to reduce the symptoms. But what should we do to keep ourselves away from allergies? First, we must figure out the allergens. We may observe our daily activities to determine the allergen. For example, we jot down what kind of food that causes your skin redness and itchiness. So this is an effective way that we should practice every single day to find out what triggers our allergy. And secondly, conducting skin and blood tests to identify the substances that we are allergic to. Therefore, the only way to prevent allergy is to figure out the allergens and completely avoid your exposure to it for at least 5 to 7 years. And this way will actually help to reduce the recognitions of our body towards the allergen and eventually elevates the allergy reactions. Please remember, don't challenge the allergens as it will increase the severity of the allergic reactions. So there was shocking news years ago whereby a lady actually died from the allergic reactions after kissing her boyfriend who had eaten the peanuts. So this news is resurfacing now to spread the awareness of the allergic reaction. So we must not underestimate the severity of the allergic reaction. However, there are some people who cure their allergies naturally. Therefore, we must do our best to keep a healthy lifestyle. And now, let me share with you the secrets of health and longevity. I believe that we all know how important our immune system. A healthy immune system can protect us from more than 90% of the diseases. Therefore, we must master the science of nutritional immunology to take good care of our immune system. Besides that, there are 4 important habits that we must practice every day to achieve a health and longevity. First, sufficient sleep. So why is it important to have a sufficient sleep? Because the research shows that the fatality of the mice with an insufficient sleep or mice with sufficient sleep actually live longer. So insufficient sleep will cause the growth of cancerous cells, hallucination, or even death. Therefore, we must get enough sleep at least 6 to 8 hours every day. And next, exercise regularly. So exercise is extremely good for our lymphatic circulation and boosting our immune system to fight against diseases. And next, be joyful and cheerful. Research shows that a joyful people have less chance of having the heart disease and tend to have a healthier blood pressure and cholesterol level. And lastly, maintain a balanced diet. So nutrition immunology taught us the three essential nutrients for a strong immune system, which is phytochemicals, antioxidants, and a polysaccharide. So with a strong immune system, we can achieve a health and longevity. With this, my sharings end here. I wish everyone good health and happiness and happy Mother's Day. Thank you.
Thank you, Daniel, for his wonderful sharing. Through his sharing, we understand that allergy is very common, especially in developed countries like Singapore. Through Daniel's sharing, we learned that some powerful food is able to boost our immune system and some tips to prevent allergies, secret of health and longevity. Has anyone tried nutritional immunologist product that wins back their health? The answer is yes. There's a 1-year-old child who developed eczema due to food allergies. Her cheek, eyelid, and fingers are severely swollen. Every month she needs to go to the clinic to get steroid cream. How she regain her health through nutritional immunologist product? Let's welcome Annie.
Good evening, everyone. I'm Annie. Tonight, I would love to share with you the testimony of my daughters. At the age of 1, she developed eczema due to food allergies. Her face, fingers, and in between her feet were swollen, red, and blistered. Almost every single night, she couldn't sleep well due to this severe itching. Constant scratching until she bled, only falling asleep from exhaustion. As a mother, seeing my daughter suffer like this every single night broke my heart, and I didn't know how to help her recover. I remember when every time when we went out shopping, everyone, children especially at her age, would stare at her for a long time, wondering why she looked so different. At that time, I didn't know when her skin would return to normal. My heart sank, feeling utterly helpless. As in the picture, we can see her both face, the cheek, and especially above her eyelid, they are all red and swollen. And her fingers on the joint part would crack and bleed, and also her legs. We went to doctor every month to get steroid creams, but they did not help much. The symptoms of redness and swelling with blisters persisted. The doctor advised us to avoid allergen food like dairy products, shellfish, and acidic fruits. However, she loves her strawberries, lemons, cheese, pizza, creamy pasta, and anchovies. Those foods are almost forbidden. Also, I heard about a method where if someone is allergic to something, they should consume small amount of it to build tolerance. So I tried, but inadvertently she still consumed allergens in her daily diet. Her skin has no chance to heal because every time it flared up, it set back a long time. I vividly remember seeing her staring at her scratched finger once, and my heart just went sore and broken because I could feel her pain and her sense of imperfection. She would ask, Mom, why are my hands and face look so different from other children? When are they gonna be back to normal? I could only reassure her that it would get better soon and asking her not to worry. When she turned 5 years old, my sister in Singapore introduced me to nutritional immunology, this preventive science. It emphasizes that the best doctor in the world is our own immune system. So I started incorporating foods that are high in phytochemicals, polysaccharides, and antioxidants. For example, like cactus fruits, rose, acelera cherries, cranberries, cordyceps, ABM mushrooms, blueberries, cassia tora, hawthorns, soy, raisin tree fruits, monk fruits, and ginsengs into her diet. After a few months of this balanced, pure, and right nutrients, Surprisingly, her skin has improved. Her immunity obviously has increased, and the frequency of eczema flare-up has decreased. She is a very confident and happy little girl now. Let me show you her recent picture. There you go. I'm grateful to Dr. Cha Fei Chen for her amazing preventive science and the convenient, wholesome food. This unique field of nutritional immunology teaching us how to nourish our immune system daily to help us preventing above 90% of diseases. That's all from me. Thank you and have a great night.
Thank you, Annie, for her daughter sharing testimony. As a mom, witnessing her daughter's struggle with eczema must have been incredibly difficult. Annie's decision to turn nutritional emojis product and incorporate them into her daughter's lifestyle was undoubtedly a wise one. Through this choice, her daughter's immune system was fortified and positive adjustments were made to her lifestyle, ultimately leading to her regain her health. Let's congrats her again. Please take note that disclaimer. Every product is specially formulated to nourish the overall body, including our immune system. However, our products are not in any way a form of medication or drug and should not be used to treat or cure illnesses. Next is our Q&A session. After the insightful presentation, I'm sure many of you have questions. Feel free to unmute and ask your question or type into the chat box. Yes, here I see there is a question in the chat room. Is eczema caused by allergies? If I have allergies, what should I do and how should I manage them? Thank you for bringing such an important topic. Do we have someone from the Q&A committee who can help to address this question?
Yes, Xiaoling, I can help to answer this question.
Sure, Jasmine.
Okay, sure. Okay, so good evening, everyone. I'm Jasmine, and this is a very good question. Is eczema caused by allergies? Okay, so if I have allergies, what should I do and how should I manage them? Right? Because many people nowadays have eczema problems, and when they go for diagnosis, it may be treated as a common skin disease. So, for example, maybe let me just share my screen over here. Then I will start my sharing. Okay. Okay. Let me use the pointer. Please wait a moment. Okay. So, for example, have you ever heard about psoriasis? Do you happen to know what's the difference between the psoriasis and also the eczema? What's the difference between A and B? Okay. So actually today I also don't know. I'm not teaching you how to distinguish among these two because most people cannot tell them apart. And sometimes even doctors also will misdiagnose the disease. Okay, so for the right side is the psoriasis and for the right side is the eczema. So psoriasis is an autoimmune disease, while eczema is not. Eczema is one of the skin diseases induced by allergies. So from the clinical point of view, we can distinguish the types of eczema by the appearance of skin lesions. So here goes to the differentiation of eczema types based on the skin lesion manifestation. So they can be classified as acute, subacute, or chronic eczema. And the cause of eczema is unpredictable and often will relapse and long-lasting, lasts for months or even years. So firstly, let us look at the acute eczema patient, the skin of the acute eczema patient. The skin lesion of the patients with acute eczema manifests as dense round papules and vesicles. So the affected areas appear skin-colored light red or light brown. So when the condition is severe, they may be small blisters gradually forming scales. So due to scratching, if the blisters are scratched or injured at the top and infected, the inflammation becomes more obvious, leading to pustules, crush, folliculitis, which can cause intense itching. So mostly distributed over the head, face, and behind the ears, the limbs, and the perineal areas, etc. So, and also mostly symmetrical distribution, meaning if it's on the inside of the left foot, and it will also appear on the inside or on the right foot. Yeah, it's symmetrical distribution. Okay, next, let's look at the subacute eczema. So for the subacute eczema is when the inflammation of the acute eczema subsides and the patient's skin lesions appear as mainly small papules, crushed, and also the scales. Only a few vesicles and erosion are visible, and the itching is still intense. So usually the acute and subacute eczema relapse and do not heal, so they can progress to chronic eczema. Some start as chronic eczema initially. Okay, so let's move on to the next slide. So from over here, we can see that the skin lesions of the patient with chronic eczema manifest as thickening and of the affected skins, and the brownish red or pigmented, and also the rough surface, and scab formation due to scratching, and also the patient will experience the intense itching. So more commonly distributed on the lower legs, hands, feet, elbows, groin, anus, etc. So what are the causes of the eczema? Okay, so here's the reason. The factors might be due to the immature development of the organ tissues, especially in children under 3 years old, who are in the growth and development stage. Some tissues are not fully developed, meaning the immune system is not yet matured, and the children often take antibiotics when they have a fever or cold. Besides that, the misuse of antibiotics can also lead to a fungal infections, inducing eczema. And the third point is that the environmental influences, especially eczema patients, need to be cautious in choosing the daily necessities. For example, if they are allergic to the chemicals in shower gel, shampoo, and detergents, they should completely avoid using them. And some people may develop eczema from exposure to a little more sunlight, like UVA and UVB, and also the imperfect skin barrier function. So from here, some people, once their skin is exposed to external irritants, they will easily develop symptoms such as redness and also the inflammation, which is commonly known as allergic skin. Okay, and last but not least, the food allergies. The severe eczema is related to the food allergies, but mild eczema may not be related. Therefore, not all eczema is caused by food allergies. The more severe, the more allergy in infants and young children, and the earlier and the more severe the eczema occurs. And also some other factors. Okay, and what are the tips to cure eczema? I will not say cure, but how to prevent the eczema from relapse. So firstly, we should avoid external irritations such as the hot bath or showers. Dr. Chen used to say that don't be misled by the term eczema, thinking it's caused by being too wet. Actually, it's the opposite. The eczema patients have dry skin, so don't soak yourself in the hot water for too long, as it will dry out the skin even more serious. So make eczema more prone to flare-ups. And also, please avoid vigorous scratching. So the more you scratch, the itchier it gets, and the more severe it becomes. So for those allergic to woolen clothes, please avoid wearing synthetic underwear and also the fur clothing. Wearing these clothes will make the whole body itchy. And the third point is that please avoid allergenic and irritating foods, and also avoid excessive sun exposure and avoid overworking. And please maintain the skin cleanliness to prevent skin infections, and also maintain an optimistic and stable mood. This is very important. So how to deal with eczema caused by the allergic factors? So if eczema is caused by allergies, if diagnosed, it is necessary to completely avoid the allergen to prevent eczema from worsening. So we do have to identify the cause of the patient's illness. Yeah, and doctors also check the patient's medical history this way to understand the medical history for how long has this problem been going on. Yeah, and for the work environment, like do you often use the chemicals such as detergents, bleach, or dry clean clothes? And also the lifestyle habitat. Do you frequently drink alcohols, coffee, stay up late, like having some bad habits? And also the emotional state. Are you under long-term stress, etc.? And also the allergy testing, like the blood test to check for allergies, like milk, eggs, nuts, peanuts, seafoods, mangoes, etc. Yeah, so do not attempt to act as your own doctor. Like you have to know what's the reason behind this piece of factor. Yeah, so often if we haven't found the allergen, we will stop eating certain foods, which can lead to malnutrition in the long run, which is the wrong approach. So second, don't do allergy tests yourself because they are expensive. Instead, please go directly to a doctor for the medication and also the consultation. If it's an autoimmune disease, such as psoriasis, steroids are used in the medical to treat the psoriasis. However, if eczema is caused by the allergic factors, the long-term use of steroids drugs to suppress the immune system can easily lead to cancer. So according to the nutritional immunology, if it's an allergic disease, you must find the allergen. Dr. Chen said, please avoid the allergen. And after a few years, you won't be allergic to it anymore because your memory won't have it. Yeah, the cells of your memory won't have it. So it won't react to the allergen. So of course, people with weaker resistance are more susceptible to allergies. So people with allergic eczema, just like healthy people, must follow the 4 major health principles, like what Daniel had shared earlier. So we must have sufficient sleep, moderate exercise, a happy mood, and also consume more nutrients that can enhance the immune system, such as plant nutrients, antioxidants, phytochemicals, polysaccharides, so that we can have a strong immune system in the long run. Yeah, so that's all for my sharing today. Thank you.
Thank you so much for Jasmine's answer. Jasmine's answer provide valuable insights, and I'm sure it will be helpful to our friends who asked this question. Due to time constraint, we will take one more question if there is any. Here I saw Daniel mention about that. Yes, agree. Do not challenge the allergens as it will increase the severity of allergic reactions. Yeah, I also agree with this. From here, I see there is no more question. Then we will end our Q&A session now. I have some great news to share with everyone.